Well, I'm just arriving at the hospital. It's Thursday the 16th, and this morning I have 3 tests that will be done. The first is an echocardiogram, and the second is a 2D echo, which is different from an echocardiogram somehow. And then the third is a PET scan, which is like a CT scan, except they inject your veins with radioactive sugar, essentially, and that sugar finds any cancerous material in your body, and then they take an image, and those places are glowing a lot more than other places. So that's what's on the docket today, and I hope I was able to get a picture of my X-ray and CT scan on a CD, and so I'm hoping that after we get the PET scan done, that either today or in a few days I'll be able to get that picture to look at and to post for people. But here we are. I'm sitting in a small room. And I just had an IV with radioactive glucose, and I had to drink barium sulfate, which tastes about as good as it sounds, to prepare for PET scan, which will happen in about, I think, a half hour or so. So I just have to wait here and watch Sports Center and hang out. Okay. My friend Eric is going to rip off the bandage from my IV earlier today, which has lots of good hair in it.
You ready for this?
Oh my god.
Jesus tattoo. 1, 2, 3. Oh! There it is.
Ooh! Ooh, that was good.
Just real nice and good.
Oh, sick.
Good morning.
It's 5:40. Just woke up for the bone marrow biopsy.
Pretty early for you, huh?
Yeah. Okay. I have a bone marrow biopsy today. Anything you'd like to say to everyone who's watching? It's probably some good advice. Anything else? Alright. Well, thank you, Klaus. This has certainly been enlightening. So I'm not allowed to have any food or water after midnight, but they said I can have small sips of water. So I asked Libby to get me a glass. She got me a glass with 2 ice cubes. And Klaus is freaking out.
Hi.
Here we go, the biopsy to get a needle in my butt.
Because chances are it won't just be obese people taking them.
Priorities. Gotta check in on Foursquare. This is what Libby looks like when she's playing Scramble. She doesn't communicate with the outside world. So I'm sitting back here in the pre-surgery room before my bone marrow biopsy, and I thought I'd introduce a few recurring characters. This is my dad. Say hi, Dad.
Hi, Dad.
You're supposed to say hi.
My dad lives out of town, like a half hour away, and this is my stepmom, Mary.
Hi.
And you might be seeing more of them in videos to come, so I thought that I would introduce them.
Thank you for watching this video, which will explain the basics of the procedure that you are going to undergo, and will discuss many of the benefits and risks associated with your procedure. You will be undergoing a procedure called percutaneous needle biopsy.
I am just getting ready to, in 10 minutes, head in for my bone marrow biopsy. I've got my IV ready to go, and they'll give me some happy juice and some please don't throw up juice and some sleepy juice, and shove an enormous needle into the back of my pelvis and test to see if there's any malignant cells in my bone marrow. So the actual surgery shouldn't take any longer than a half hour, an hour, and could be in recovery for an hour or two, but here we go. Sitting here, getting ready to have my bone marrow biopsy. I've got some oxygen and like 4 or 5 awesome drugs that are making me feel like everything is perfect.
Okay, got everybody?
Hi, sweetie.
A little bit too quickly.
Dr. Coda,
That was kind of quick.
1101.
Oh, take a picture?
10-4, 1101.
I made it.
As soon as he wakes up from his
So you didn't feel anything?
red light.
No, it just felt like I could feel the pressure of it. It felt like they were like jackhammering into my bone, but it didn't hurt. It was weird.
That's good.
And it didn't take too long. So now I'm just chilling.
Chilling with a fan on.
Yeah,
Get the spa treatment.
getting the sweat on.
You were pretty sweaty, huh?
Mm-hmm.
Thank you.
Yep, you're welcome. You guys take care.
Thank you guys.
Yep.
Libby's opening her birthday present that I got for her.
What if I guess what it is?
Don't guess, just open. There's like a little thing you pull there.
Oh, there is?
Yeah.
You can tell how many books are in Amazon.com. Books there, I said it. I knew it was it! Yes! So much to say.
So do you like the Dave Matthews
I
Band?
love the Dave Matthews Band, and I really wanted to read it, and you know I've looked at Barnes & Noble every time we've gone, and they never have it. Yes. Best birthday gift ever.
So, on February 1st, Libby and I first heard the word lymphoma, which set in motion a series of events like CT scan, X-ray, meeting with oncologists, and stuff like that. So we knew right away that this vacation that we had planned, February 15th through 18th to Las Vegas, was not going to happen because Libby's birthday is the 18th and mine's the 22nd, so we were going to celebrate. So that weekend, Libby called Delta Vacations, which is who we had booked our vacation through, and tried to get our money back so that, you know, we could go on a vacation later this year after I'm not sick anymore. And they refused to refund us the flight. I used like 17,000 Sky Miles to book that. Those will not be refunded. They're making us pay a $360 fee in order for us to get the rest of the money back in a voucher. So even though it ticks us off and we don't want to fly with or use Delta Vacations again, we have no choice because they gave us a tiny percentage of our money back in a voucher. So, here, hand me the camera. We're posting on Facebook and Twitter on the Delta Vacations page, and I've tweeted at Delta Vacations. So they're getting a little bit of little bit of hate mail right now because I was just diagnosed with cancer and they don't have the heart to give us our money back.